Hello, welcome to Health Tips with Shalom Health. Have you ever wondered whether endometriosis could be cured by diet? In this video, we're going to discuss the role of diet in endometriosis. Towards the end of the video, I will tell you about a resource that can be used to monitor whether your diet is helping your symptoms or not. Endometriosis can cause painful periods and may have complications such as infertility, depression, etc. Why do women resort to trying diet modification? It is because the current treatments available are not curative, even though they may help to reduce pain and increase the quality of life. These treatments sometimes have unpleasant side effects, and sometimes after the treatments, there may be recurrence of the endometriosis. This leads to a lot of women trying other alternative methods such as nutrition, exercise, etc. I will first define what endometriosis is for those who may not be familiar with it. Endometriosis is a condition where tissue similar to the lining of the womb grows in other places, such as the ovaries and fallopian tubes. Endometriosis can affect women of any age, including teenagers. Symptoms of endometriosis include low abdominal or pelvic pain during periods, severe enough to stop you from doing your daily activities, pain during sex, pain when urinating or passing feces during periods, problems getting pregnant. There is another video on this channel that deals with endometriosis symptoms. You may wish to watch that. Causes of endometriosis. There are many factors involved in the causation of endometriosis. Some of them are genetic, ethnicity, immune system, and lymphatics. Endometriosis involves inflammation as part of the way it causes symptoms, and it is also believed to be hormonal mediated. In this case, estrogen encourages increased endometrial growth and worsening of symptoms. Research on the relationship between nutrition and endometriosis is far from complete. Some studies have shown results that support a role for nutrition, while some have shown observations that do not support a role for nutrition. There is no specific diet that can cure endometriosis, but certain foods can help to reduce inflammation and balance estrogen levels. Estrogen is the hormone that can make endometriosis worse. Foods to eat. To fight inflammation and pain, it is best to eat a well balanced diet that is primarily plant based and nutrient rich. Fiber foods, for example, fruits, vegetables, legumes, whole grains. They help to lower estrogen levels. The fiber binds to estrogen in the gut and it comes out as waste. Iron rich foods such as dark leafy vegetables, broccoli, beans, fortified grains, nuts, and seeds. Foods rich in essential fatty acids such as salmon, sardines, trout, walnuts, chia, and flax seeds. If you don't eat fish, you may wish to consider omega-3 supplements. Supplements that may help: vitamin E, vitamin C, vitamin A, vitamin D, calcium and magnesium, and vitamin B1. Please consult your doctor before using any over-the-counter supplements. Foods to avoid: trans fats found in fried foods, processed foods, and fast foods. Red meat and processed meat. Alcohol and caffeine. Sugary drinks. The foods to be avoided can promote inflammation in the body and thereby worsen endometriosis symptoms. What about dairy products? There's no consensus on this. Some dairy products contain a high percentage of saturated fat and many types of hormones, which may aggravate endometriosis. A study found a higher intake of dairy was associated with a lower risk of endometriosis. Some reputable sources recommend it and some don't. Downsides to using special diet to control symptoms. Special diets such as low FODMAP diet, gluten-free diet can be restrictive. Low FODMAP diet could make one to be at risk of developing nutritional deficiencies. One could lose weight rapidly or gain weight rapidly. Women who are planning a pregnancy are advised to be cautious in changing to an endometriotic diet. It is important to make sure that you're getting the right nutrients needed for your stage of life. It is impossible to say what dietary changes women should make in general, as everyone is different. Do not change to gluten-free diet unless you have been medically diagnosed as having gluten sensitivity, which is celiac disease. There is a study that showed reduction of symptoms in people who avoided gluten in their diet, but the result was not conclusive. What next? It is better to adopt a lifestyle of healthy eating. This comes with additional benefits like losing weight, and it also reduces the risk of some chronic diseases like type 2 diabetes, hypertension, etc. Points to note: there is no cure for endometriosis. Conventional treatments, i.e., surgical and medical treatment, remain the most effective options. Diet may play a role in reducing symptoms of endometriosis. It is not a treatment for endometriosis on its own. It should be regarded as adjunctive or complementary treatment. Endometriosis guidelines from different countries have not recommended diet as a treatment on its own due to the lack of solid scientific evidence. Symptoms vary from one person to another, so treatments that work best for one person may not be right for another. Please take your time to experiment. You may need up to 3 to 6 months for this. Please try to pay attention to how your body reacts when you eat certain foods. Consider keeping a food and symptoms diary. The symptoms can be graded on a scale of 1 to 10 so you can monitor the progression. I believe this is the most important aspect of trying to work out whether a certain diet helps you or not. So, if one is not doing this, then it could become a guessing game. Consider consulting with a registered dietitian to help you plan meals that will be best for you. Disclaimer: the information on this channel is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content on or available through this channel is for general information only. No professional relationship is formed between any member of Shalom Health and yourself as a result of getting information from this channel. You're encouraged to confirm any information obtained from and through this channel with other sources and review all information regarding any medical condition or treatment with your physician. Thanks for watching.